Good morning. Welcome everyone to this CASIA webinar, Caregiver Mental Health and Wellbeing, Implications for the Professionals. Thank you for taking the time today to join us. My name is Patty Crawford. I'll be your host today. This is my 44th year with CASIA from our Augustana Elam side. I at present am the CASIA Director of Engagement, working our service standards into the texture of everyday life here at CASIA. Some housekeeping. Volume, please turn your computer tablet volume to the maximum volume for the best audio experience. Audio, video, all attendee microphones and cameras will be muted and turned off. Please use the chat feature. That's the fun part of these webinars. Include questions and thoughts as we go along, but we will address them at the end of the presentation during our question and answer period. We may not get to all the questions, but we will try our best. We are CASIA. About 3.5 years ago, Elam Care and Augustana Care, two legendary organizations in aging services, joined together. And together, they represent over 200 years of history in human services that goes back and in a rich, rich history. CASIA was named for an anointing oil that's said to symbolize the healing heart of the servant. It was chosen because it so perfectly expresses and represents what CASIA is all about. At this time, CASIA has over 5,000 employees, 1,500 volunteers, and we affect the lives of so many people each day. The CASIA community is guided by 8 core values. This is why we do what we do: compassion, integrity, excellence, innovation, stewardship, unity, respect, and collaboration. So thank you for coming today and collaborating with us on this presentation. Now I'd like to present Carol Ashwood. Carol received her master's degree in social work from the University of St. Thomas, St. Catherine, and is a licensed independent clinical social worker at Open Circle Adult Day Center and Support Services. She is a certified caregiver consultant through the Minnesota Board of Aging and is a certified independent trainer for Teepa Snow's positive approach to care. Carol's professional interests include group work, caregiver, psychoeducational, and peer support, and these programs that serve individuals living with dementia and caregiver counseling. She is an adjunct faculty at the School of Social Work at the University of St. Thomas and has taught the course Social Work Practice with older adults and their families. I've had the privilege to work with Carol for many years, and I have been in her classroom where she is such an advocate for work with older adults and their families. Also, Carol has many other talents. Any workplace she's ever been in, she brings her gifts of music. Carol knows caregiving from the professional level. She knows caregiving from the personal level, and she knows it from the scholastic level. So what you hear today comes from her heart. So now I want to present to you and let Carol take over this wonderful webinar.
Thank you so much, Patty. So here we go. All right, so thank you for inviting me to speak this morning. As you can see on this slide, this presentation is part of a longer offering that was given on November 3rd, 2020 at the Veterans Administration. And that presentation was entitled Caregiver Mental Health and Wellbeing During COVID-19. And you can see here that this presentation was created and co-presented with my colleague at the University of St. Thomas, Tanya Rand, and 2 incredible MSW students, Brittany Lieb and Annie Myers. I would also like to note that Brittany was a social work intern at Open Circle this past academic year. Today's presentation will not have a direct focus on COVID-19. However, results from a few studies that did look at the effect of COVID-19 on caregivers will be shared. So our goal for this morning is to cover caregiving in context. We will look at the impact of caregiving on mental health, and we'll focus on supporting self-care and well-being for caregivers. We will also briefly talk about caregiver assessment, general information on intervention strategies, and I will share some resources relevant to caregivers. We're going to start by briefly looking at the context of caregiving and caregivers. And I want to note that I'll be using the word caregiver because that's what's used in the research that I will be citing. I actually prefer the term care partner because it suggests a partnership, but to be consistent with the literature, I'll be using the word caregiver this morning. So who are we talking about? Well, there are formal, just trying to go back one. Oh, there we go. There are formal caregivers, and these are paid providers in one's home or a care setting. And then there are the informal caregivers, and that's who we're talking about this morning, whether it be a spouse, a partner, family member, an adult child, a friend, and they assist the care recipient with activities of daily living. And in America today, there are more than 1 in 5 people are caregivers. Now, I think it's important to note this third bullet point down that it says over 6 in 10, but I'd say only 6 in 10 caregivers perceive themselves as being the primary and unpaid caregiver. So therefore, I think this is important. We have to realize they may not identify as a caregiver and not seek needed support and resources. Only 4 in 10 caregivers considered their health to be excellent or very good, and this has dropped significantly since 2015. Unfortunately, there's also been an increase in the amount of caregivers who rate their health as fair to poor. And according to the National Alliance for Caregiving and AARP, more than half of caregivers felt like they didn't have a choice in taking on the caregiver role. And it's interesting to note this is especially true with women, Generation X caregivers, Asian Americans, non-primary caregivers, that would be the caregiver not living with the care recipient, and those in rural areas. Caregivers are more often reporting that they're caring for someone with Alzheimer's or a related dementia. And the average time spent in caregiving is 23.7 hours a week. Now, probably not surprisingly, caregivers who live with the care recipient spent almost 15 more hours per week caring it for an average of 37.4 hours per week, nearly equivalent to a full-time job. And it's also important to note that African Americans, Hispanic Americans spend more time caring each week than white and Asian Americans. And I think this is interesting, this last bullet point. Since 2015, there has been a 7% increase in younger caregivers aged 18 to 49 who are in high intensity caregiving situations. All right, so let's talk about some of the challenges unique to caregiving. There's a term called wayfinding, and that's the journey of informal caregivers as they learn to navigate how to care for the care recipient at home. And as you may know, there's often little ongoing support from healthcare professionals to assist caregivers in this highly and demanding and challenging role. And the role can last for many years. Other challenges, putting one's life on hold. This Peacock article focused solely on spousal caregivers, and some examples of this were things like making adjustments to life, less recreational activities, making adjustments to employment, retiring or quitting, taking time off, moving locations. And caregivers of those with dementia may feel less freedom because of they're unable to leave the care recipient alone. There's a decline in social relationships, financial hardships, that's a big one. There are a large amount of hidden costs in caregiving. There's the unpaid labor, and each year that's $522 billion in informal care costs, and decline in physical health. Nearly 1 in 4 caregivers felt their health had worsened because of the role of caregiving, and many, 1 in 5, are in high strain physical caregiving situations. But let's not forget about the benefits. Caregivers may value many aspects of caregiving, and it's important for us not to pathologize caregiving. Things like personal growth. Caregivers may be proud of being able to take over decisions and take on the physically demanding tasks of caregiving, learning new duties significant others may have done, like cooking, shopping, maintenance, finances, and cleaning. Fulfilling a commitment to spouse. I hear that a lot from caregivers. A greater sense of purpose, increased closeness with a care recipient. That's another one I hear a lot from both adult children and partnered or spousal caregivers. And mastery and gratification with the caregiver role. So I just provided you with a snapshot of what caregiving looks like overall. In this next section, I want to start a conversation about the impacts of caregiving on a caregiver's mental health and well-being. According to the American Psychological Association, these are common challenges for caregivers, and I have seen many of these in my practice with caregivers. Things like depression and anxiety, whether it meets criteria for a depressive disorder or an anxiety disorder, it might just be symptoms. Something they call subclinical stress, and that's stress and anxiety that do not meet criteria, again, for a mental health diagnosis. High rates of negative affect, including guilt, sadness, dread, and worry, ambivalence about care, witnessing the suffering of a relative, becoming easily upset or irritable, feeling isolated or abandoned by others, and anticipatory grief. And I'll just share what that means. That's a grief that comes from an impending loss, and you're anticipating an impending loss. Typically, the impending loss is the death of someone close to you because of an illness. I've also seen grief that accompanies the caregiving journey, especially ambiguous grief and loss, and particularly with caregivers caring for someone with dementia. Often they grieve losses along the way. There's the grief of a diagnosis, the grief when maybe the person cannot drive anymore. Also the grief when placement occurs. So those hits along the way that happen. And I find it useful to validate these feelings for caregivers and normalize it and name it. Sometimes just naming it as you're grieving, that can be a relief for caregivers, knowing that's what I'm feeling. We can't really talk about caregiver mental health without talking about caregiver burden. And one way to define caregiver burden is the negative reaction of the caregiver to their social, occupational, and personal roles. Additionally, there are 2 types of burden. There's objective burden and subjective burden. And objective burden includes the time and finances devoted to caregiving, whereas subjective burden deals with the informal caregiver's perception of burden. And I'll be using that word perception a lot this morning because it's the caregiver burden particularly is perceived differently from one caregiver to another. There's a concept called disengagement coping, which is a style of coping in stressful situation that removes oneself from the situation. And it would include things like wishful thinking, avoidance, emotional suppression, self-criticism, and social withdrawal. Research has also found that this coping style actually increases caregiver burden. And additionally, you can see that that final bullet point on the left side, behavioral disturbances from the care recipient is a risk factor for developing caregiver burden. All right, so now that we've talked about some general effects of caregiving on mental health, specifically caregiver burden, I'll briefly discuss how you might assess a caregiver's well-being. And we're fortunate that there are a number of standardized tools that you can use. Now, remember, these are not diagnostic. We're not diagnosing the caregiver. We're looking for where there might be some risk. And maybe based off of that, we might make a referral, or we might know how to focus our work together. So the first 2 listed here are tools to assess caregiver burden: the Zarit Burden Inventory and the Montgomery-Borgata Caregiver Burden Scale. They both come in different versions, ones with more items, some with less. And the Montgomery burden inventory or burden scale is very comprehensive. It uses 3 different burden scales to measure burden in the relationship, internal burden, so that would be the time caregivers have for themselves, friends, and subjective stress burden. There are, you can see 4, there are more than this, but these are the ones that I chose to list. Tools to assess depression. The Center for Epidemiological Studies Depression Scale, which we call the CESD, the Geriatric Depression Scale. That one can be very useful because it uses a yes-no format. So for some people, that might work better. The Beck Depression Inventory and the Patient Health Questionnaire, which many people know that one. That's the PHQ, commonly used in primary care clinics. And I'll note that of these listed on this slide, I have used both burden scales for different reasons. The Montgomery burden scale I use when I work in person with a caregiver, but the Zarit burden inventory I've used during the pandemic when my interactions with caregivers were virtual, because there is a 6-item inventory, and that's a lot easier to do when you're not in person with a caregiver. And under the depression scales, I've used the CESD when I'm in person with a caregiver because it's a longer tool. And I've used the PHQ-4 when I worked virtually with caregivers during the pandemic. So it's nice that there are choices, different choices of tools to use. Just a few more tools you might want to consider. There are a couple here I've listed to assess anxiety. The geriatric anxiety inventory is a nice one because, again, it's agree or disagree, somewhat like the geriatric depression scale. And the straight anxiety inventory is one you might consider. And then I have listed other assessment tools. I like the caregiver wellbeing scale and the revised scale for caregiver self-efficacy. Both of those are very strength-based. The well-being scale measures caregiver strengths and areas where additional support is needed. And the self-efficacy scale, it measures a caregiver's belief that they can successfully carry out caregiving behaviors. And then I also included the Texas Revised Inventory of Grief that has been used successfully with diverse age groups, including older adults. And I'd be remiss if I didn't note that there are tools that are part of evidence-based caregiver programs that some of you might be using, part of REACH2, the REACH2, or also the TCARE, the Tailored Caregiver Assessment. And also to note that some of the tools that you use may be dictated by the agency that you work for. All right, so I talked briefly about assessment screening tools, which would be covered under the 4th bullet point here on what to cover in a caregiver assessment. But there are 7 other areas to consider when assessing a caregiver. So obviously we want to know things like background of the caregiver and the caregiving situation. And I think the second one's really important, caregivers' perception of the health and functional status of the care recipient. You know, it matters more what their perception is than what we might see as reality. So what is their perception? Caregivers' values and preferences, health and well-being of the caregiver, consequences of the caregiving on the caregiver, care provision requirements. Often I ask about, or I routinely ask, is there an emergency plan for care if something were to happen to you? And most of the time, people don't have that plan in place. Resources to support the caregiver and family and community supports. All right, so I'm going to briefly take a look at caregiver interventions, just a general look. So you can see here that in general, effective interventions utilize strategies that address the full scope of caregiving. They are flexible and they are the right length or dosage of treatment. And what they have found is rigid approaches that do not really address individual treatment needs. And dosage, not surprisingly, what it's found is that ongoing support had the best outcome for caregivers. A one-size-fits-all approach does not address caregivers' individual needs. Psychoeducational, psychotherapeutic approaches are most effective with caregivers, and they have been shown to reduce stress. CBT, or cognitive behavioral therapy alone or in conjunction with a psychoeducational approach, has been shown to have good outcomes. And studies have found that improved coping skills, a reduction in dysfunctional thinking, and again, self-efficacy are positive outcomes of therapeutic interventions with caregivers. And there's an emerging interest in using mindfulness techniques for improved mental health, stress, and symptoms of depression in caregivers. And I'll talk about mindfulness a little bit more in just a little bit. And we know caregivers are diverse. I'll stress that a lot this morning. And I have seen that the one-size-fits-all approach may not be effective. I've also found that utilizing a combination of approaches based on the individual needs of a caregiver is important. I know that COVID-19 is decreasing and the restrictions generally have been lifted, but I think it's still important that we consider the impact that the pandemic has had on caregivers. The research I'm citing here is the effects of COVID-19 on family caregivers, a community survey, and it was developed by a team of researchers from the University of Pittsburgh. On the right side here, you can see that this study identified the differences in how the pandemic uniquely affected family caregivers compared to non-caregivers. So you can see that risk factors associated with decreased caregiver well-being, things like gender, being female, being in a minority group, less education, and income status, those who are young and those caregivers who had mental and behavioral issues, and those who live with the care recipient had more difficult outcomes. Additionally, 43% of caregivers said their mental health was a little or a lot worse. And 53% of caregivers reported feeling sometimes, often, or always uneasy. And I think it would be easy for us to think that caregivers have bounced back from the effects of the pandemic. And really for all of us, I think it's important for us to continue to check in with caregivers and with really all of our clients as to the residual effect of COVID-19. Here are a couple other snapshots of studies from 2020. The first study you'll see on the left is a qualitative study that was completed at the University of Minnesota School of Social Work. The study looked at how caregiving changed and the benefits and the biggest concerns where caregivers received their supports. And on the right side, this was a study through the Rosalind Carter Institute for Caregivers called Caregivers in Crisis, Caregiving in the Time of COVID-19. Similarities between the two were that people had limited social and physical interactions, increased social isolation, reduction in support and therapies. That was a very common concern during the pandemic, and a decline in caregiver wellness. So we've talked about the concerns and the challenges. How can we support caregiver well-being and self-care? Well, let's start with a couple of definitions. Self-care, as defined by the World Health Organization, is defined as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. You can note here that it's not just an individual's job, it's also a community-wide job. It takes a community, or as they used to say, it takes a village. The Center for Disease Control and Prevention on their website defines well-being as the presence of positive emotions and moods, such as contentment and happiness, the absence of negative emotions, so depression and anxiety, and satisfaction with life and fulfillment and positive functioning. So what's the importance of these? Performing self-care improves well-being, so there's a relationship. It decreases morbidity and mortality. Think about that, decreases morbidity and mortality and reduces healthcare costs. So again, It's on an individual level, but this is also on a societal level. Higher levels of well-being are associated with speedier recoveries, increased longevity, higher productivity at work, and an increased likelihood that individuals will contribute to their communities. So it's just a win-win situation. And with caregiving, the goal of self-care is to increase supports and resources. That's where we as professionals can come in, so that caregiving demands are reduced or relieved. And I like that the word reduced is in there. I think that's realistic. We might not be able to eliminate those demands, but can we help reduce those for caregivers? And then caregiving and self-care were incredibly crucial during COVID-19, as you can see here. That was found in a study. All right, so ignore the COVID-19 in the middle of this. I neglected to take that out. But I want you to look at the 4 domains around that center circle, because self-care and well-being can encompass many aspects. And this model here, the biopsychosocial spiritual domains, are often explored. And as you can see, they overlap each other, and the 4 domains are the same size because they're equally important in a person's life. So for example, in working with a caregiver, I found that when a caregiver, for example, doesn't do things like exercise, not only is the physical or biological domain affected, but also psychological well-being is affected. Likewise, when caregivers are able to practice mindfulness, which would be in the spiritual domain, they may feel more grounded and able to connect with people socially. So the spheres or the domains overlap. All right, so let's start with that biological or physical domain and self-care and well-being within that domain. So I wanted to talk about some of the challenges in each domain and explain the importance of each. The Family Caregiver Alliance reports that caregivers are more likely to report chronic illness than non-caregivers. And that's because it's so hard. It really is. The biological self-care can be so challenging. One I hear a lot is not getting enough sleep. So not getting enough sleep because of caregiving demands can make physical wellness more difficult. Finding exercise can feel challenging, especially for those who live with their care recipient. And often, and I'm sure you have seen this, the caregiver's main focus is on the health and wellness of the care recipient, not as much on their own. So you can see the Mayo Clinic on the right side recommends some supportive strategies for caregivers, and these seem like common sense, but they are really important. And what I like is it refocuses the focus on the caregiver's health. Things like eating well, getting enough sleep, that one's really big. Going for daily walks. A lot of the caregivers I've worked with, especially during the pandemic, found that crucial for their well-being. Taking medications as prescribed, keeping medical appointments. That's a tough one for many caregivers. And seeing doctors when they are sick. I'm going to read this quote because I think it's a really good quote. Self-care is not about indulgence, it's about self-preservation. And I want to make a note or say a word about self-care. Many times caregivers have told me they do not have time for self-care, or thinking about self-care just frankly overwhelms them. It's one more thing for them to do, or it's one more thing for them to do that they're not doing right. I can't even take care of myself well enough, people have said. Or caregivers often have said, stop telling me to take care of myself. So what I do in that situation is I challenge caregivers just to come up with one thing they're going to do in the next week, because the whole idea of self-care can be so overwhelming. So I might say, what's one thing you're going to do in the next week? Maybe it's make that doctor's appointment that I've been putting off. Maybe it's getting out for a walk twice in the week. And then caregivers find it good to be accountable, to come back and say, I did make that appointment. So then what else are we going to do? So building on that, starting small. And I've also asked caregivers what it would mean to take care of yourself. One time a caregiver answered, it would mean that I'm being selfish. And I thought, wow, okay, that gives us a place to start to explore that further, because we can't get to the self-care if we don't explore first. that meaning that I'm being selfish if I take care of myself. So it's good to uncover what are those barriers rather than just saying, take care of yourself, explore that further. So I'm in the psychological domain, and I want to talk about coping, stress and coping. And I'm just mentioning one model today, and this is the work of Lazarus and Folkman. With this model, there is a situation or event. And for this example, we'll use caregiving during a pandemic. So the person, again, a caregiver, would engage in primary appraisal, which they would ask themselves, is this a problem? For some caregivers, no. For others, maybe. Is this a challenge? Is this harmful? Is this a threat? Then there's a secondary appraisal process. So, all right, if this is a problem or a challenge, how am I going to solve it? Do I have the ability to cope with this problem? This next one I think is really important. Do I have the resources to attack this problem? And during the pandemic, many resources weren't available. And that last bullet point says, do I have some control? So after the appraisal process, the result determines how much stress is on the caregiver. And as you can imagine, this will vary greatly from caregiver to caregiver based on things like ability to cope, resources available. And what is highly stressful for one caregiver may not be for another. So it's important for us not to make those assumptions. And the pandemic in this example is just one. You could apply this model to all kinds of caregiving situations. So continuing with stress and coping, if the result is stress, then how do we cope? And here's a definition of coping: constantly changing cognitive and behavioral efforts to manage specific external and internal demands that are appraised as taxing or exceeding the resources of the person, exceeding the resources of the person. So I want to note that it's important to acknowledge that there are systemic barriers to coping. There are social justice concerns, especially for marginalized caregivers, that make self-care and well-being more difficult to obtain. This could be due to less resources, for example. So when, according to this model, the result is stress, caregivers will primarily engage in either focused, emotion-focused, or problem-focused coping. I like the emotional focused coping. This is what it can look like. Validation, these are some strategies. Reframing, glass half full. Prayer, mindfulness, meditation. Gratitude and journaling. I know a lot of caregivers who use that strategy. A daily gratitude assessment, for example. Participating in a support group. Self-compassion, good enough. Often I will ask caregivers, maybe that's good enough. It can be such a relief to say, oh, I don't have to be perfect. It can be good enough. And meaning making. And then there are these problem-focused or action-oriented strategies, things like taking action, making that needed appointment, accessing resources such as respite care, and setting boundaries. That can be a big one for caregivers, and we can help them to do that. Resilience and psychological well-being. So resilience is defined as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family or relationship problems, serious health concerns, and workplace or financial stressors. And when you attend to the 4 domains of well-being, the biological, psychological, spiritual, and social, you really are building resilience when you are in those different domains of well-being. And I want to make note that resilience can be learned, and it's a tool for now and the future. So people aren't just born resilient. It can be learned, it can be built. And resilience can help us to manage a crisis, stress, and anxiety. And I ask caregivers and people in general this question a lot. How have you dealt with stress in the past? What helped you get through difficult times? And can you use what has helped you in the past as a tool for today? So I might reflect with a caregiver back on tell me about a challenging time in your life. Well, they might say, oh, it was when I was going through my divorce. So what helped you get through that? Well, yeah, I know prayer helped me a lot, or I really leaned on this good friend of mine. So are those tools that can be useful today in today's challenging situation? So continuing in the psychological domain, these are just some resources, caregiver support groups. So there are some sources of support groups listed here, and caregiver mental health support listed as well. And links for these will be sent to you with other resources presented today. So that will be emailed to you. And the reason for the computer screen on the right was to depict that during the pandemic, many support groups were held virtually. And some of these now are beginning to be offered in person or in hybrid versions. And some are remaining virtual. I'm associated with the Alzheimer's Association. I facilitate a caregiver support group. And our group is in the process of determining whether to stay virtual or to meet in person. So that has changed a bit in the delivery of caregiver support group. All right, so the social sphere of self-care and well-being. Let's move on to this one. And it may seem obvious that a caregiver's well-being will be enhanced if they connect to others socially, but this really can be a challenge due to caregiving needs. And you can see the Family Caregiving Alliance says that accessing respite is helpful, using community services that minimize direct support, like an adult day center, such as Open Circle. Learn about the disease or chronic conditions of the care recipient. That's an example of that psychoeducational intervention. And asking for and accepting help from others. Both of those are really important. Asking for the help and then accepting the help. And we can help support caregivers in doing that. And caregivers may not recognize that maintaining social connection is important. Again, they may be putting the focus on the care recipient's needs before their own. And you'll notice Mayo Clinic in the yellow box here, they have some suggestions for staying connected. And one of them is tending a garden, which I think is in a couple of spheres. It can be in the social sphere, but also the spiritual, which brings us to spiritual well-care and well-being. Spirituality is known to positively affect people's mental health, especially in times of crisis and acute disease. So here are some examples of ways caregivers could use spirituality to practice self-care and enhance well-being. Some of these I mentioned under the psychological self-care and well-being. Noting the bottom, I don't think you can see the bottom bullet point, but that says practicing mindfulness. And that is an emerging area in caregiver work. So let's go over to that. Spiritual self-care and well-being focused on the mindfulness. What is it? What is mindfulness? It's a focus on being deeply aware without interpretation or judgment of what you're sensing and feeling in the present moment. And it can involve, not necessarily, but it can involve things like breathing methods, guided imagery, and other exercises. So what are some benefits? And this has been researched and found to decrease stress, anxiety, depression, and insomnia. And not only that, it helps with pain and blood pressure, diabetes, and other health conditions. Other benefits, it's good for our hearts. It may decrease cognitive decline. It may improve your immune response and reduce cell aging. And it may reduce psychological pain. So here are some examples on the right side, just paying attention, being intently experiencing in the moment. So in the moment, slowing down, and that's good for everybody, slowing down, paying deep attention, living in the moment, as I've said, focusing on your breathing. Some people practice a body scan meditation, a sitting meditation, a walking meditation. Even things like, I was in a class once and we were challenged or tasked to mindfully eat an M&M. First, looking at the M&M, touching it, putting it in your mouth, paying attention to the texture, the taste, we don't, a lot of us don't do that when we eat, but when you slow down and really are mindful, it's really something. Or focusing on a flower, the different shades, the color, the shape, the stem, really attending in the moment, focusing on other things in nature. So it doesn't have to be a full-fledged practice. It can be something you do in the moment. Some people, though, find a practice or a guided resource to be very helpful. So the Mayo Clinic has these mindfulness resources. These will be sent to you in a resource list following the presentation. A Place for Mom has some activities on mindfulness. And the Family Caregiver Alliance has mindfulness meditation specific to caregivers. Here are some more resources. Again, these will be shared on a resource list that will be sent to you. So just a whole host of great sites that you can visit for caregiver in general, local resources on the right, including AARP, MinnesotaHealth.org, and additional organizations like the Brain Injury Alliance, the Alzheimer's Association, and the National Alliance of Mental Illness. So I'm just going to put these up here for a moment. I am open to your questions, but here are some questions I might have for you that we could learn from each other. Things like, what strategies or self-care practices are working for the caregivers you interact with? Let's learn from the caregivers themselves. What are they doing that's working? And that's a question I often ask caregivers. What's working well for you? Instead of talking about what's not working, let's start with what's working. So if you can share that with us in the chat, that would be great. Or what is one thing you might think about or try to do differently after today's presentation? All right, so I'll give this back to Patty.
Oh, what a wonderful presentation. I have so much on my mind after this. In the chat, there were questions about the handouts and CEUs. So please email Kate, there'll be the address at the end, so you can receive those, because this presentation is packed with really useful information. There was also a question about the tools. You know, when we were listing the different tools you used, Carol, are these tools appropriate for caregivers and not for the care recipient?
That's correct. Yes, and you, those, I cited those, they're from the American Psychological Association. There's a site called Assessment Tools, and there's a lot of information there about validity and reliability for caregivers. So yes, they are intended for caregivers.
I was really impressed and happy that you bring up the joys of caregiving too, because when I look back at my caregiving experience as a professional caregiver, I didn't acknowledge I was a caregiver, and followed that with, I would not give that time back for the world. It was very important.
Yeah.
Let's see what else we have here. Oh, Jill shared that gratitude journaling, walking, and listening to music were very strong elements in her self-care. Time in nature and helping my clients who are caregivers.
Yeah, that's a big one, that time in nature. I've heard that so much, especially in the last 18 months, how important that has become to people.
And I also think about, as when you brought up the mindfulness, that mindfulness, especially if you're caring for someone with perhaps memory loss or dementia, but that mindfulness and paying close attention can actually be a shared tool that you use with the care recipient.
Nice, yes.
There's a question about long distance caregiving. I think it's very complicated, filled with guilt, but how best can someone from a distance support a care recipient?
I think going back to the pandemic, one thing I think we learned that can be very helpful is the virtual nature I've done of interactions that we can have. So I think one way, and I've done this I do family meetings with the system around the care recipient, and you can include the long distance caregivers on a Zoom family meeting, for example. A lot of times long distance caregivers, they feel guilty. They're not in town able to do things for the care recipient. But if we involve them in a family meeting and give them a voice and give them an opportunity to do some things long distance, that can be very useful, I think. So including them, acknowledging that it's hard to be a long distance caregiver. That's a big challenge, and supporting that and the emotional needs of the long distance caregiver that are different than caregivers who are in town or physically near the care recipient.
Yes, and then you arrive in town and you feel you have to do everything.
Yes.
In the next 15 minutes and undo everything that your sister did. So
yes,
there's a lot of dynamics in this.
There is, and I think that's where dialogue is so important. So those resentments don't get built up. I hear a lot like, oh, my sister in Pennsylvania, like she just never. So let's talk about that, because people are making assumptions, I find. So I think dialogue's so important.
Mm-hmm. Yeah, because the tired caregiver has the impression that, my sister breezes, and that I've heard that word, breezes into town.
Yes.
And but really what sister is trying to do is to help out. So you're right. That's so helpful, Carol, that there's questions about technology, and you just talked about that.
Mm-hmm.
And techniques to avoid caregiving conflict. Yes. Here's a question. Oh, let me look right here. My elderly mother lived with me during the worst of COVID. I video recorded memories of my mother, which was fun for both of us and helped her and me. And what a treasure to have that. What a good idea.
Oh, that's so beautiful. I love that.
And then here from Louise, I was the caregiver for my mom who has now passed away. I'm so sorry, Louise. I'm interested in supporting caregivers in my church. Can you speak to what churches are doing to care for their caregivers? And then she also thanks you for this wonderful presentation.
Oh, how nice. Yes, that's a great question. So I'll just share what I know, but if others have knowledge about what churches are doing to support caregivers, I'd love for you to put that in the chat. So again, we can learn from each other. I think it really depends on the church. Some churches have, a focus on caregivers. I think of Normandale Lutheran Church in Edina. I know they have a center for wellness that's focused on caregivers. So I think it depends on the church. I think certainly there can be more done for caregivers. A parish nurse, those churches that have a parish nurse, they do work with caregivers. So that might be a source to connect with. But I'm wondering what others know about, faith community churches, nurses I see in the chat, provide caregiver support services. So the faith community nurses, that is the parish nurse. So that's a great comment. Mm-hmm. But is there anything else you're seeing, Patty, with people commenting on how churches are involved?
I not quite yet, but I see that Jill brought up reminding caregivers about their strengths.
Yes.
And I think when you started this presentation, you warned against making it a pathological problem, being a caregiver, that this is an important, strength-filled, vital, and rewarding role in life too. I think sometimes we go, it hasn't been portrayed as that in the past.
Right.
So that is, here, this one goes right to my heart. Is there a decrease of caregiver stress after placement in long-term care, or is there more?
That's a great question. My My research project when I was a Master of Social Work student at St. Thomas St. Kate's was exactly that. It was the effect of long-term placement on family caregivers. And to your point, some things change and some things don't. So what I found in the results was there was relief, but there was also guilt. And there was a shift from caregiving to being the care advocate. So it doesn't all go away with placement. It's replaced by some different things, some positive. Like I said, there was relief, but even describing the relief for a caregiver brings up guilt. Oh, I shouldn't be relieved. I feel so guilty. So it's a mix of things, but it doesn't take away, it just changes where the stress and the emotional aspects go.
I found in my journey, when my father went into long-term care, I decided one day to like everyone who took care of my father, and realize that they get to have their own relationship with my father. And that helped me a lot. And it made for a better relationship. But navigating that is, I didn't know that before. I didn't, because I didn't know the feelings. So
Yeah, I agree with you, Patty. But the same when my parents were in long-term care, it became like an extended family to our family because they received such good care. So yeah, I think that's a lesson to learn.
yeah, and aiming caregivers at building that bridge,
Yeah.
building those relationships. Yes, I felt guilty. I wish I could have done it all, but I couldn't. Oh, here, Eileen says, our church hosts a monthly caregiver support group. It's currently via Zoom, and it always includes prayers for one another.
Nice. Yeah.
Could you speak a little more, Carol, about what your thoughts are about the value of the virtual as opposed to the in-person? I think we're all exploring that area right now.
Yeah. In my caregiver consultations, there's a lot of things I have appreciated about Zoom and my caregiver support group. And I don't know if our support group will choose to go back in person because there's something very efficient about the Zoom-based. And for a caregiver caring for someone at home, that's been a really nice aspect that they can Zoom from their home. So I think there's a lot of pluses. With my individual caregiver work, I did find that I had to adapt a lot of things to the virtual. The other thing that gets lost, I think, virtually would be that in-person reading of emotions. You can do it on Zoom, but it's a little, well, of course, it's better in person. So I think going forward in my work, I will probably have a hybrid of how I interact with caregivers. I mentioned the family meeting. In the past, I'd have somebody on speakerphone, but having everybody's faces there on a Zoom call when we have somebody on the West Coast, somebody on the East Coast, and people in Minnesota, that can be very, very important. So I think there's a silver lining from this pandemic, and that is new ways to serve people. And yes, did I answer the question?
I think so, because that getting to the support group can be another burden.
Exactly.
And the virtual would be so efficient. And also the voice of all the caregivers connect not just in the little box in the center of the table, but to be on the screen. I hadn't even thought of that. That makes people feel a part of it. And you can ask the questions, how they can share responsibility. Here from Maureen, great insight, making a decision to like caregivers and becoming an advocate. Well, I guess I'm in the business I am in. Our church works on carrying the visitation as desired by the caretakers when their loved one goes into long-term care. Oh, carrying on that visitation, like being present in the long-term care facility. And oh, do we love to have that in our facilities at Cassia, to have visiting clergy. Let's see if there's anything else here in the chat. Oh, there's just so much to talk about, because many people don't know they're caregivers, and it happens one day where we all play this role. And I think you've been so articulate about framing that for us, and tools that can be used, and celebrating it and supporting it. What would we do without the informal caregiver in this world?
Oh,
And
absolutely.
I think that's, in our standard of collaboration at CASIA, I really feel that. And that's one of the major pieces of collaboration, because we're in this together. So I think that is.
I just wanted to note something else, because I agree. It's so good that we recognize the strengths of caregivers, and that it's not a terrible journey. It's not one-sided. It's that paradoxical thinking that we can use. It's both and. It's both so valuable and treasured to have the opportunity to be a caregiver. At the same time, it is stressful, and recognizing caregivers that might need that extra support, who are at risk for, poorer outcomes. So it's both. It's both a wonderful journey, but it has some inherent stresses. So that's where we as professionals can step in and really support family caregivers.
Oh, thank you so much, Carol. And thank you all out there for your participation in this webinar. We have an upcoming one with Chaplain Nancy, the Enneagram and You, if that's enticing for you. It'll be on Wednesday, June 30th, 6 to 7 p.m. So a little after dinner, you can relax and spend time with Reverend Nancy Carlson. She's our CASIA VP of Spiritual Life. So thank you all. I hope you have a wonderful, pleasant day out there. Here are some contact information for you. Christine, thank you for your help today, and you can contact Kate and for handouts and CEUs. So I really appreciate this day, and thank you so much, and thank you from CASIA.